Cataract is the opacity of the lens that distorts the image projected onto the retina and that can progress to blindness.
Causes of cataract. The most common cause of cataract is age-related. As we age, some of the protein in the lens may clump together and start to cloud a small area of the lens. This is a cataract. Over time, the cataract may grow larger and cloud more of the lens, making it harder to see. Next is congenital. This is what doctors call it when babies are born with cataracts. They may be caused by infections, injury, or poor development in the womb, or they can form in childhood. Next is secondary. This happens as a result of other medical conditions like diabetes. They can also result from being around toxic substances, ultraviolet light or radiations, or from taking medicines such as corticosteroids or diuretics. Lastly, traumatic. These form after an injury to the eye. Other things that can increase the risk of getting cataracts include smoking and heavy drinking.
Signs and symptoms of cataract. First, clouded, blurred, and dim vision. Second, difficulty vision at night, sensitivity to light, seeing halos around lights, reduced vision, poor contrast sensitivity, and changes in vision.
Management of cataracts. The symptoms of early cataract may be improved with new eyeglasses, brighter lighting, anti-glare sunglasses, or magnifying lenses. If these measures do not help, surgery is the only effective treatment. Surgery involves removing the cloudy lens and replacing it with an artificial lens.
Let's talk about otitis media. What is otitis media? It is an inflammatory disorder usually caused by an infection in the middle ear.
Of acute otitis media. The eustachian tube is the tube that runs from the middle of the ear to the back of the trunk. An AOM occurs when your child's eustachian tube becomes swollen or black and traps fluids in the middle ear. The trapped fluid can become infected. The eustachian tube can become swollen or blocked for several reasons. For example, allergies, cold, flu, sinus infection, injected or enlarged adenoids, cigarette smoke. The main cause of this disease are allergy, cold and flu, sinus, smoking, and drinking alcohol. Symptoms of acute otitis media. First is ear pain, especially when lying down or tugging or pulling out an ear. Next is difficulty sleeping or crying more than usual. Next is acting more irritable than usual. And lastly, the difficulty hearing or responding to sounds.
Management of acute otitis media. First is antibiotic therapy. For the pain management, analgesics and paracetamol. And the right positioning, you must lie on an affected ear and encourage and follow up treatment to ensure resolution. And advise patient that sudden relief of pain may indicate tympanic membrane rupture. Do not instill anything in ear provider. Instruct patient to follow up for recurrence of symptoms such as pain, fever, and ear congestion.
Otitis media. The cause is usually caused by acute otitis media, blockage of the eustachian tube, which connects the middle ear and the back of the nose, or an injury to the ear or blast injuries. Some symptoms of chronic otitis media. Persistent blockage of fullness of the ear. Next is hearing loss, chronic ear damage, development of balance problems, facial weakness, persistent deep ear pain or headache, fever, confusion, or sleepiness.
Chronic otitis media, topical antibiotic or steroidal treatment until symptoms reduce or resolve. Then, systemic antibiotics are usually not prescribed except in case of acute otitis media. Careful suctioning under microscope guidance and installation of antibiotic drops or antibiotic powder is used to treat purulent discharge.